Let's talk about blood supply to the spleen. Let's see how blood flows from the heart to the spleen and the spleen back to the heart. So, the left ventricle pumps blood. Blood flows through the ascending aorta, the arc of aorta, the descending thoracic aorta. The descending thoracic aorta passes through the aortic hiatus of the diaphragm at the level of T12 vertebra to continue as the abdominal aorta. The abdominal aorta at the level of upper border of L1 vertebra gives off a branch known as the celiac trunk. The celiac trunk, which is also a hepatolinogastric trunk, also known as tripod stem of Haller, runs for about 1.25 centimeter before it gives off three branches. The three branches are common hepatic artery, which runs towards the right. Then there is the left gastric artery, which runs upwards towards the cardia of the stomach, and it is the smallest of the three branches. And then we have the splenic artery, which runs towards the spleen, and it is the largest of the three branches. It is the one that supplies the spleen. The splenic artery is very tortuous in its course. The distance between the abdominal aorta and the spleen is approximately 10 centimeters, but the distance or the length of the splenic artery varies between 8 to 32 centimeters. And that is explained by the tortuosity of the splenic artery, which allows for the mobility of the spleen. The splenic artery in its course is divided into four segments by Michel. We have the first segment, which is the suprapancreatic segment. It is a short segment of around 2 centimeters, running inferiorly from its origin towards the pancreas. Then we have the pancreatic segment, which is the segment of the splenic artery that runs along the superior border of the pancreas. It is very tortuous in its course, and there are different variations of tortuosities. You can have looping, it can be undulating, or it can even be coiling. Then we have the pre-pancreatic segment, where the splenic artery runs anterior to the tail of the pancreas. And then finally we have the prehilar segment, which is the segment between the tail of the pancreas and the hilum of the spleen. Now, as the splenic artery courses along its length, it crosses the upper part of the left kidney and the left suprarenal gland. It enters into the splenorenal ligament and then enters through the hilum of the spleen into the spleen. Before it enters into the spleen, it divides into 2 to 3 terminal branches, also known as lobar branches. Then these terminal branches further divide into 5 to 7 segmental branches. These segmental branches then supply separate segments of the spleen. The spleen is supplied by approximately 300 ml per minute of blood, which is approximately 6% of the cardiac output. This pattern of distribution has variations. There are two arterial patterns of branching that have been identified. We have the distributed type, where we have the main trunk, which divides into terminal branches at segment 2 or 3. So we'll have the main trunk and long terminal branches. And then we have the magistral type, where we have a long main trunk which divides at the perihilar segment into short terminal branches. So the distributed type is the more common compared to the magistral type. Once blood has been supplied to the spleen, it drains through veins that join to form splenic vein, which emerges from the hilum of the spleen, courses through the splenorenal ligament, courses posterior to the pancreas to the level of the neck of the pancreas, where it is joined by the superior mesenteric vein to form the hepatic portal vein. The hepatic portal vein drains blood to the liver, then from the liver through the hepatic vein through the inferior vena cava to the right atrium. And that's how blood flows back to the heart. In the next section, we will see how blood flows through the spleen from these segmental branches towards the splenic vein. Thank you.